Okay, so get started.
Watch her play hockey. Oh my God.
Hello, everybody. Welcome. So probably before we even get started, everybody's heard we had 2 police officers that were killed last weekend. And so we're just gonna have a little moment of time for that.
The video. And there. And good.
On that note, thank you.
Close enough.
Okay,
Good morning.
good morning, everybody.
Good morning.
Thank you, Rita. Hello, hello.
Hello.
Okay, let's call the meeting to order and I'll take a motion to approve the agenda.
So moved.
Okay, same on the minutes. I'll take a motion to approve the minutes from our March 14th meeting.
Move to approve the minutes.
Second. Second. All in favor? Aye.
Aye.
Aye, same sign. Thank you. Do we have any public comment? Nope. Okay, thank you. And then receipt of information from supervisors that are not on this committee. Do we have anybody on? Nope. Okay. Okay, number 6, presentation on social determinants of health.
All right, so we'll turn it over to Helen and
Okay,
to talk about what are social determinants of health. And this came as a request from Chair Middleton last month
Yes.
to learn more.
So last month we presented the CHA, the Community Health Assessment, and had this request for a little more information on the social determinants of health, which we kind of referenced quite a bit in the CHA. So go ahead and go to the next slide, please. So the definition of social determinants of health is the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, function, and quality of life outcomes and risk. So essentially they're non-medical factors that influence health outcomes. You can see our little graphic on the side, just outlining what some of those social determinants of health are. So education, access and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. I also kind of wanted to mention that the reason that it's important to acknowledge the social determinants of health isn't necessarily because we as public health can change all of these social determinants, but we can, by acknowledging the social determinants and how they influence health, it can kind of guide us toward where we can focus our efforts, where there might be greater needs in our communities. Next slide, please. So education, access, and quality. Education influences mental and physical health, economic stability, access to healthcare, substance abuse and misuse, and health equity. So some things within education that might determine or influence a person's health would be whether or not they're a high school graduate, whether or not they have higher education, their language and literacy level and skills, and childhood development and education levels, all of those things. And a lot of these tie together as well. So a person's level of education may influence their economic stability. It may influence the quality of care that they receive if their health literacy isn't quite as high as someone with a higher level of education. Next slide, please. So we have healthcare quality and access to care. Means having equal access to convenient, quality, and affordable care for all that is trauma-informed and culturally responsive. This includes factors such as proximity to care, diversity training for staff, diverse backgrounds of providers, cost of care, insurance coverage, medical transportation, and care coordination within the healthcare system. And then, so we kind of listed some of the bullet points: healthcare, primary care, insurance coverage, and health literacy would all be things that impact healthcare quality and access to care. The built neighborhood and built environment refers to the human-made structures that occupy a certain space. In terms of neighborhoods, it includes things like sidewalks and walkability, green space, public transportation, parks and playgrounds, and other structures that can influence a person's health. So access to healthy foods within the neighborhood and the environment, access to transportation, air and water quality, local crime and violence can of course affect a person's safety. Housing and safety is tied back into local crime and violence and things like that. Next slide, please. So social and community context refers to the settings in which people live and work, and it includes relationships between people as well as the connections between people and institutions, whether those be social, religious, cultural, or occupational. So some things that fall under that umbrella would be like civic participation, discrimination, workplace conditions, incarceration levels, support systems within the environment, and levels of community engagement. Next slide, please. And then economic stability influences the ability to access both mental and physical health care, nutritious foods, and physical activity opportunities. Things that impact economic stability, income, living cost, poverty, housing, socioeconomic status, and then food security are all kind of tied together under that umbrella term of economic stability. Next slide, please. So this is just kind of an overview of how these social determinants are linked. So at the bottom, you'll see the health outcomes are things like mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. And then at the top, we see the social determinants of health, some of the factors that play into those determinants, and then they ultimately can affect health outcomes. And again, a lot of times these are tied together. For instance, the walkability of a neighborhood may influence a person's physical activity levels, which may influence health outcomes. Healthcare quality and access may impact a person's morbidity, mortality, functional limitations, depending on whether they're able to afford care and access care and get the providers that they want. So a lot of these things all kind of tie together. And that, of course, can tie to economic stability. All right, next slide. So economic stability, healthcare, and quality and access to care and education were identified as the social determinants of our health priorities from our CHA, which, if we recall, we had nutrition and physical activity, we had substance abuse and misuse, and mental and emotional health. And we saw that these things tended to stand out as things that were tied to those health priorities. Some specific things were job loss and high unemployment rates affected economic stability. The COVID-19 pandemic and the precautions that were put in place impacted the healthcare system, economic stability, and then of course the education of both youth and college students was affected by school closures, sudden shifts to virtual learning. So just important to keep that context in mind as well of the pandemic and the way that would have affected the social determinants of health, and then potentially some of our health priorities. All of these identified factors will be considered when developing our Community Health Improvement Plan, or our CHIP, which we do have some more slides here where we'll go into our next steps. So next step is completing, after the CHA, is completing the CHIP, the Community Health Improvement Plan. So our overarching goal is the Polk County Health Department will promote and protect the mental and physical health of its residents by beginning to address the health priorities from the 2022 CHA by the end of 2024. Anticipated completion date of the CHIP would be no later than June 30th of this year. So then we have some specific objectives related to our health priorities that we identified. The first health priority was substance abuse and misuse. We want to promote substance use prevention amongst Polk County residents by implementing or expanding at least 5 initiatives. So some of the activities that will be involved in that would be facilitating community workshops around substance use prevention and education by the end of 2024. Increase the promotion of Narcan education and distribution by the end of 2024. Work with community partners to explore and begin the process of building a community partner group to address substance abuse and misuse in our county by the end of this year. We are going to conduct alcohol compliance checks for alcohol retailers, which will ensure that alcohol is not being sold to underage individuals. And then similarly for tobacco, conduct tobacco compliance checks for tobacco retailers in Polk County by the end of 2024. And then promote and implement alternative to suspension programs to schools to be implemented into their tobacco-free school policies by the end of 2024, which centers more around education and prevention rather than punishment and suspension. Next slide is mental health was our next health priority. So we want to increase mental health awareness amongst Polk County residents by implementing or expanding at least 3 initiatives by the end of next year. And those activities would include promote the Mental Health America screening link, provide access and distribute mental health resources for the public by July. Work with community partners to explore the process of building a community partner group to address mental illness and mental health issues in our county by the end of 2024. And then our last health priority that was identified in the chart is nutrition and physical activity. Our overall objective will be to increase awareness of local opportunities for Polk County residents to improve nutrition and physical activity habits by implementing or expanding at least 5 initiatives by the end of next year. First activity to support that would be to promote online food access resources by linking Polk County residents to food finder sites. Promote and expanding POP outreach at local farmers markets, which is focused on increasing access to fruits and vegetables to youth. Promote and expand the WIC farmers market participation. Promote local resources such as the Polk County Recreation Viewer on the Polk County website once per quarter. So we want to make sure we're promoting that so that people are aware of physical activity opportunities that are available within our communities. And then work with community partners to explore the process of building a community partner group to address physical activity and nutrition issues in our county by the end of 2024. And that's the end of the presentation.
Good job. Thank you.
So that was number 6 and number 7, all rolled into one. Yeah, nice segue, Jason.
So I think,
Yes, Helen had sent out, but I can forward that just directly to you. Yeah.
Great.
so it came to my attention that at Walmart, they're featuring at least two garments that are all about like hangover hoodie. I got toasted in St. Croix Falls. And to look at the priorities, just having the priorities conversation about the full board and then these priorities. I, for one, am going to make a phone call and in my role, if that's okay, and just say, what the actual hell? So just putting that out there as a what the actual hell. If we're trying to promote these values, why are they selling that crap here? I know it's not, shutting down all the meth labs in the county, but it's still like really offensive to be watching y'all work so hard at this in law enforcement and health and human services and then have that kind of crap. So anyway, if you want to call them too, you
Did you
can.
say Walmart?
Wasn't it Walmart?
I don't know.
Yeah, I think so. I'll have to research. I will let you know.
You have healthcare and access to healthcare on there. Is that, because I feel like we are lucky to have St. Croix Health, Amory, Osceola and things like that. And then as an extension, you know, we're lucky that we're an hour away from some of the best medical, you know, places you can go with Children's and Mayo and things like that. So is that more of an issue of people not taking advantage of those things and not like the healthcare and access to healthcare, like what are we looking at with that?
So access to healthcare, the primary way that tends to impact health in our communities is when it ties with economic stability and, you know, people don't have the appropriate coverage or can't take the time off of work or just have difficulty accessing the care due to facing obstacles there, not necessarily the infrastructure that's in place in our community.
That's why, yeah, I just wanted to make sure on that because it seems like you can take a handful of these, even the access to nutritious food, and healthcare and access to healthcare and things like that, and not to blanket everything, but it all kind of can get connected to economic stability because if somebody doesn't have economic stability, they might have access to go to a farmer's market or marketplace or anything like that, but they're not going to because they're going to go to Family Dollar or Dollar General because it's going to cost them $8 versus $18.
And that's where some of our programs like our POP initiative come into play where youth can get tokens to get fresh fruits and vegetables at the farmer's market by participating in our
You
activities.
get them excited and tell them, Mom and Dad, I want to go to this place.
Education.
Yeah, because I mean, I want to be careful on this because I can easily become the bad guy in saying something like this. But personally, like I'll make no bones about it. Like I'm not super happy about the proliferation of dollar stores in our area. I think that's a bad economic indicator for our area. And so I'll say this, I like seeing the efforts around education and encouraging people to, you know, stay out of those as far as nutrition goes and to get healthy food and things like that. So that's really cool to see. So thank you for that.
Yeah, you think about it, if I may. Later on the topic, we're talking about transportation,
Yeah.
which may help access to healthcare, to nutritious food. I know we're working on an effort to enhance telemedicine. You know, you think about our big geography and our veterans or people who don't have transportation. If we can educate folks to how to use telemedicine, work with the hospitals, work with transportation or whatever, but if we can get people with broadband or high-speed internet and how to use it, why it's worth it, or how to get it affordable. I think we got some things in progress to help us in these areas. And I think your plan is hitting some key areas.
That's one more question. So I don't want to,
Yeah, go ahead.
on the piece on implementing a promoting a program on education and prevention rather than punishment and suspension at schools. Can you go a little bit more into that?
So that's something that Felicia is really working on a lot. I'm not quite as familiar with all of the details, but a big push right now is alternative to suspension programs where if a student is caught smoking or vaping or using tobacco products in school, the classic route to take has been suspension or some form of punishment. And there's a big push right now to look more into providing education, cessation resources and things like that, as opposed to suspension, because that's not necessarily an effective way to get someone to reflect on the reason for their punishment.
So they have evidence-based curriculums where students can go through like a 6-week or 6-course class. And it does show that then they are more apt to follow through with more cessation programs. And we've done some outreach to the schools about this. It can be either a free course so they can train their staff to implement the course, or there's scholarships available. So really the cost to schools is free, it's just their capacity. So
that's
we're
it?
continuing to like explore that, like how can we assist, how can we support, how can we break down those barriers?
And it's just within that realm of substance abuse, then it's not like if I have a kid punch somebody in the face in my class, we're not stepping in and saying.
Yep.
Right.
Well, the other observation I made when I was reading this was that there's a striking line in the sand between those in our county who have a high school education and those who do not, and all the things under it. Alcohol piece, the vaping piece, the ping pong piece, it was really striking. So for capital, I mean, the education piece is, I don't even know, how do we get more people to graduate with a high school degree or get a GED or whatever it is? Because it shows in the numbers that it's an important thing, it seems like. So that was just a striking observation, but.
Thanks. I would like one of those. 'cause
Yeah,
I
oh yeah,
missed-
you weren't here for this.
I wasn't
meeting.
here for
Yeah,
that
yeah,
meeting and I want to
yeah.
read
It went to my
that.
mailbox.
And it is Walmart.
Okay,
I heard from my source.
okay. Any other questions?
I have a question, excuse me. What are they selling at Walmart that we're objecting to? I missed that.
They're selling shirts that celebrate substance use. This is my hangover hoodie was one of them, and I got toasted in St. Croix Falls.
Okay,
Yeah. Measles, anyway.
We
Bill Heck.
good? What? Bill?
Amy, I was just gonna say, one of the key pieces there for education is for the people that are incarcerated, you'd be amazed at how many people are not high school graduates. And I think that programming that they've been, way back when I did it, but the programming at the jail for completing your high school diploma, working on an HSED, working on a GED, and now having Northwood Tech involved is extremely important because it gives them an opportunity for those inmates that are going to be incarcerated for at least a year. And if they haven't finished, it gives them that opportunity to finish up. And at least they have a goal to shoot for by the time they're done serving their sentence.
Are you working with them now?
I am not.
You just-
Since Northwoods has taken that over, I have not.
I know that the jail programming is great and it's really come a long way.
Yeah, it was interesting when we first started doing it, and it continues to do that.
Anybody else? So does that mean we're done with 6 and 7 in one swoop? Is that what you're saying, Tanya?
That's what I'm saying.
Okay, so now we're down to 8.
Okay, so.
Nice job with that, Jason.
Thank you.
Thank you,
Thank
Jason.
you.
And Helen and crew. Okay, so we have, seems like it's been going on for a long time. Transportation, the feasibility study that we are rounding out, completing. If I recall, I believe that then Supervisor Pritchard is one of the spearheads of starting to talk about transportation and transportation needs in the county, probably 5, 6, 7, 8 years ago, something like that. So it's been a topic for a long time. We were finally able to get some resources to be able to complete a feasibility study. And we have Edwin Rothrock from the Regional Planner's Office in, is it Menominee? Eau Claire. And he has been our facilitator, number cruncher guy that has spearheaded the survey for us. We were just the people who handed out surveys and encouraged participation. So we'll start out with Edwin sharing the results. He's got some printed copies. If you need a copy, we can get you a copy after the meeting. And then I think when he's done, Laura and I, mostly Laura, will talk about next steps as far as what we've come up with for ideas.
Sorry, these aren't found.
Is this what I'm,
Yes.
I'm good then?
How old is that?
Last meeting?
It's been updated, hasn't it? A little bit, few weeks.
Okay, yeah, okay.
And I don't think you all have the. So sorry it's not bound. This is an edit from yesterday afternoon, so it's hot off the presses. So in fall of 2021, we talked with the ADRC here and with Tim Anderson about doing a transit feasibility study for Polk that got approved in last year's budget, 2022 budget. And so we started, I think, just about now, a year ago. And we were looking at, if we can go to page 4. The objectives, their study objectives to identify unmet transit needs, transportation needs, identify and evaluate potential solutions to meet those needs, develop some budget estimates for the preferred solutions, and to develop a list of next steps to be taken if the county decides to move forward with any of the options. I'm going to digress a little bit and touch on the health outcomes. And there's a study from a couple of years ago that did looked at people who had been discharged from emergency care and and then looked at the people who did not get their follow-up medical attention as had been prescribed. And the number one reason that was cited by those people when they went out and touched base with them was lack of transportation. And so the people that are in the demographics that tend to have less reliable transportation also tend to put their medical care off and end up in emergency rooms and then not follow up with their care. And so, transportation is a really important part of health outcomes as well as some other things. We put together an advisory group, and the members of that are listed on a later page, and then put together some goals with that. So improve access to medical care being at the top. Shopping and errands, because that can go a long way towards food security, educational opportunities, employment, of course, social and recreational opportunities, because people that are engaged with their community have much better long-term health, and just makes for a stronger community. Connection to other regional transportation systems, particularly a lot of people mentioned Minneapolis-St. Paul International Airport. And then freedom of choice for modes, because a lot of people are locked into single, particularly in rural areas, locked into personal vehicles. And then look at the solutions and trying to come up with something for the next steps that's financially sustainable and cost effective. Next slide, please. So one of the things we do is we map the demographics, the locations of the demographics that have high transit propensity, the likelihood that they will use public transportation or transit solutions besides private vehicles if they are. So the next few maps, I won't belabor them too much, but you have the total population and where it is. You can go a couple pages forward. There's total population, and the next one will be population 60 years or older, and these are the concentrations. You can see that as you get out into the more rural areas of the county, you have an older population, not surprising. Populations with disabilities, next slide. You tend to see those concentrated more in the, I'm not sure urbanized areas is the way to describe them, but population concentrations, people with disabilities tend to cluster in those because it's easier to get around and better services. The next one is the number of people without personal vehicles. And once again, those tend to be in the more populated areas for obvious reasons. The next slide would be people living below the poverty level. And you do see that in those areas. Although you do see particularly in the northeast section of the county, there's not a lot of green and white up there. So the aging populations in rural areas tend to start slipping below the poverty level. Next, we looked at assessing transportation needs, and we went with the advisory group. We had 3 meetings with the advisory group, you go to the next slide, it's got a list of the people that were in the advisory group. So originally we had Tim with the county, Cheryl with ADRC, as well as Tanya and Laura. We had some representatives from private industry because we thought that for the employment side of it, it was important to have representatives that could, what are their needs for workers? It's all over this region. Getting workers in at a reasonable rate, wage is a problem. So we know that that's a transportation need. Terry Howard sat in. We had Andrea Jarrett from St. Croix Health, who sat in with that because for the obvious reasons for healthcare. And then we have not that we kept them for long, but we did have a couple of representatives from people that are already providing some transportation services. We had Cabusson Buses and the representative in the area from VAO. VAO, they do the non-emergency medical transportation for the state through for people with low incomes. So one of the things we did is we did a survey, an online and paper survey. I will say right up front, this is not a statistically valid survey. To do a statistically valid survey for an area the size of a county like this would be very expensive. But we did reach out. We had almost 600 respondents, which is very good results. And like I said, we did a combination of paper and online. And 83% of the respondents indicated that Polk County needs a public transportation service. Some of this is very predictable. When you look at almost any time you go out, people want it. They want the service. They want the service to come to their door and pick them up. They want it available 24/7. And they don't want to have to wait long periods of time. They'd like it to be on. That's universal across every transportation study I've
And
ever
not
done.
pay for it, at least much.
And pay less than $5 to travel all the way across the county, exactly. Yeah, and so obviously those are mutually unrealistic goals in a resource constrained environment that we all work in. So, but it's good to know the balance of what people think is important there. When we asked them what they'd use transportation for, shopping, healthcare, social and recreations, and then get to work was down near the bottom. People with jobs tend to be more able to get themselves around. They can afford vehicles a lot of times. So it wasn't too surprising to see that. One thing you do see though, if you do implement transportation solutions, is that there's people that can start working that couldn't have worked before. Say a couple where there's a single vehicle and the second person in the couple just is not considered that they can get to work. And so not surprisingly, where people wanted to go, St. Croix, Amory, Osceola, Balsam, Luck, that's where it's all happening. If we go to the, yeah, thank you. Yeah, those are all pretty predictable, questions 1 through 6. Question 7 on the next page, at the top left of the next page. Would a transportation service operated solely within the county meet all of your transportation needs? So over 50% said not always, or no, it wouldn't. So that's always going to be a challenge, and regional connectivity is an ongoing issue, particularly when you're talking about rural counties that have a predominantly rural or large section of rural areas that are then close to metropolitan area like the Twin Cities. So, but that's also a tough nut to crack for regional transportation. Question 9, what's the most important thing about transportation? Would encourage you to use it. Cheap. They want affordable fares. Most people had answered this, had access to vehicles, but we still had almost 20% that didn't or wasn't reliable. Then the question 11 was an interesting one, particularly when you compare it to question number 10. Do you rely on anyone else for transportation? And almost half of the people said that sometimes or all the time they rely on others for transportation. So even if they have access to a vehicle, it's not a vehicle that they control all the access to for about half the year, or they don't feel comfortable driving themselves. Employment status. I'm not going to belabor this because you all can look through this at your leisure, and reading a bunch of graphs is sort of pointless. You will see that the people on question 17, what is your age? That I'm sorry, it's a little bit of a confusing graph there. The bars are the number of people that answered age, and then the lines are off to the right. You can see the percentages of people in that age group. So the blue bars are the combined online and paper copies. But the age is skewed towards the older populations for the paper copies. So we just wanted to call that out because of the way the paper copies were distributed probably. So 35 and older, 35 to 64 is the highest age group of the respondents, and then 65 or older, we still had quite a large percentage there, over 40% of the combined respondents. So that's, once again, that will skew towards people that have more of a need for some sort of transportation solution they don't have now. As part of the public outreach, we also did a couple of open houses. They were poorly attended. So we didn't get much usable information there, although it's still important people have a chance to come in, look at some of the plans. We had mock-ups of what the various solutions might look like and things like that. The people that did show up were in favor of it, and they wanted the best possible outcomes, just like everyone else does. We did map on the next page, on 18, we did map the attractors, the places that people would be heading to. And as I said earlier, the places where a lot of people live is where everything's happening. So not surprisingly, those were the majority of the attractors were there. St. Croix Fall, Amory have the highest combinations of those various things. Here's a list of the travel destinations that we did map. So you know what we looked at. So then we looked at those needs. We looked at what the possible solutions might be to meet those needs. And then working with the advisory group, we prioritized those needs or those possible solutions based on what was realistically achievable as the next steps for the county. So the first option we looked at was a mobility manager. A mobility manager is someone who organizes a single point of contact that can help guide people to the available resources. Sometimes getting from point A to your hospital is a complicated process and takes more than one step. Most people are not experts in what those possible solutions are. And so a mobility manager is someone who can look at those available resources, look at not just the vehicles that can get people places, but the funding that will help pay for those. And they become experts in what all of the opportunities are, the requirements for particular programs and things like that. And they can help steer people to the best use of the available resources. And there's some people on the advisory committee felt that there were available resources that were not being well leveraged right now. And so sort of as a first step, being able to do that is something that they felt strongly would be a good first step. Mobility managers can also look at the grant opportunities that are available out there. They can assess the needs. So once they maximize the use of the available resources, what would the next set of resources be? What are the funding opportunities for that? What would the use of those things be? And so they become experts in the county itself, what exists and what might exist and how to make those things happen. There are organizations called transportation management associations in most places. That has a specific legislative meaning in Wisconsin. So sometimes they're called transportation management organizations, and that's the terminology I used here to avoid any confusion. Those can be funded by, and often are funded by, a mix of healthcare, large healthcare providers, employers, public revenue, county support or other local support. Sometimes specific cities, even within county-wide or regional-wide, they are contributors to it to make sure that their residents are have the best transportation resources available. So that's a step beyond just a mobility manager, and that would be EMOs can do things like set up van pool solutions. Those are particularly for employers, large employers, where they can have 5 or 6 people are there in a van pool. They split the costs of that, and then it's also subsidized sometimes through federal, state, or local funding. So what those next steps would be is something that they would be looking at there. And they also do marketing, because a lot of times people don't know what's available out there. And so sharing what the resources are, and that there's maybe a single point of contact that you can get the most use out of those contacts by going to, is an important thing. Yeah. So funding private organizations, employers, healthcare providers, government grants, and then sometimes foundations do a fair amount of support for those TMOs. The next service option we looked at was an on-demand shared ride taxi program. That would be similar to what is operating now in River Falls and in New Richmond, Chippewa Falls, the one I work with. That can be done as a county-wide operation. I did a transportation feasibility study with the city of Hudson last year. They're actually next year are implementing a shared ride taxi program. It's a little bit more challenging in a county because you have more dispersed population and longer travel times, but it's been done. It's done in a fair number of counties. Not as many in the Midwest as when you start getting into the Pennsylvania, Virginia. Almost all of those counties have shared ride taxi programs that are operating there. So you have to model a way that would look to get a good feel for the numbers. The model we looked at was it would be a third-party service provider that would provide their own vehicles. So you'd go out for a bid and you would basically hire them. It would be a capped, almost all of them are done on a capped basis. So you'd have a certain amount of hours that would be billed at whatever the contracted rate that came out of the procurement process was. And then we looked at the number of vehicles because, for instance, New Richmond has 2 vehicles on the road, Chippewa Falls has 8. And so that changes the number of rides that you can possibly give. And so that changes the numbers. For this, we looked at 2, I believe. And the hours and days of service, of course, that changes it. Just for this model, we looked at 7 a.m. to 7 p.m., 5 days a week. I will say one of the downsides of that is people that work retail or tourism or hospitality. Those do not tend to 5-day-a-week jobs, and they also don't tend to end by 7 o'clock. But you will also see greatly diminishing usage of any system you have after, say, 6:30 or 7 o'clock at night. And then you'll also have fewer people that would use it because there's no medical, there's no, people that work 8 to 5 jobs or 9 to 5 jobs will not be working on the weekend. So just all of this would be variable. We had to build something for the model. So that's what we used. And then I looked at the rides per capita for some of the other shared ride taxi programs and modeled what that might look like. And we'll get to the financials for that. But just so you know, those are the assumptions we were looking at for that. Shared ride taxi has a lot of very positive things going for it in that it goes basically, it's often called door to door, but it's more accurately called curb to curb. So you go to where people are and you take them to where they want to be. There's no issues with, the only bus stop is miles away from, a mile and a half away from where I want to go, and I'm not that mobile. So, and it does allow you to just cap the total usage. So it's a very known financial aspect there. The other option we looked at is fixed route service, which would be similar in some ways to what they have, the Bay Area Rural Transit up on the North Shore. They run fixed route service in a rural area. So we kind of looked at that model. The advantage there is, when the buses are going to be there, it's a known factor. With shared ride taxi, particularly when you're running with few vehicles, you don't necessarily know exactly when it's going to be there. So fixed route, you get to the bus stop, you know when the bus is going to be there, give or take. And it allows you to do some things like we looked at I modeled at least a routes that would go north to south, and you can see them there. The north to south route is the red one, and the east to west route is the blue one. They both go through Amory and Balsam Lake and over to St. Croix Falls, because those were the primary destinations. But for instance, you could run the north-south on Monday and Wednesday and the east-west on Tuesday and Thursday. That serves a lot of the needs that people have for medical and for shopping. And studies have shown that when you run this sort of alternate day service, that medical providers get very adept at scheduling people that are relying on that for those days that the bus service is running for those regions. So it does have some downsides in that it doesn't provide any transportation for people that are more than, say, a half mile away from a designated bus stop. It also comes with the overhead of needing to, you have to supply complimentary paratransit service if you run a fixed route bus. And that means any 1.5 miles of the route has to have service that is equivalent in many measures to what somebody that was on a fixed route would have. That is normally done in a situation like this. You'd actually run your short buses would be probably what would be here. And that would mean you'd have to run the short buses deviated from the fixed route. And so in the winter, with some of the roads that you have within a half mile of some of the highways, you can imagine that would be a little bit challenging. And it's expensive. So let's see, some of the disadvantages: capital expenses for the vehicles. Larger vehicles may require CDL licenses, commercial driver's licenses. Deviated fixed route, the larger vehicles can be different to maneuver on rural roads. If you provide it with a paratransit with alternate vehicles, then you have the cost of those vehicles as well. And if you do use a deviated service where it's only on certain days of the week, then it does not provide reliable service for people to get to work. So it kind of hamstrings the ability to use it for that. And it reaches many fewer residents, particularly the ones outside the population clusters. And fares on fixed route must be discounted for disabled and elderly people by at least 50% off of what the full open fare is. There's some caveats around that. BART up on the North Shore, they run a hybrid service where they actually have the fixed route, and then some of the villages and cities actually run a shared ride taxi program inside the village to take people to the bus stops that are on the main highways.
That would be the best, I think.
It is the best, it is far and away the best service, yes. If you're only looking at quality of service, that is the better one, yes. So the service recommendations there on the bottom right of 24, based on the cost effectiveness and the realistic expectations for what can be accomplished as first steps towards improving the transportation options for the county. The advisory group recommends the following services. It's not unanimous, but it was, I would say, the majority, a large majority of the people thought that this suggestion for service options was the most likely to be done. And it allows for more steps to be done because you've got a dedicated person looking at what those steps might be and what the funding sources might be. And also ongoing assessment of needs. And it gives someone to spearhead and concentrate interest from other people within the county, other organizations within the county. So the suggestion is, first, the recommendation is to hire a mobility manager that's specific for the county with the goals of maximizing the use of current transportation resources, assessing the possibility of forming a transportation management organization that would be funded with cooperation from the possible funding sources that we talked about earlier, and then an ongoing review of public needs. So here's the numbers for what the expenses and funding would look like for the first two options. The mobility manager there, you can see that the total expense is $88,000. I used a model to build out these benefits and indirect expenses that we use at the RPC for when we do contracted work, because basically the suggestion is that the person, and I think there's some more concrete plans that'll be discussed momentarily, the person would be residing within a existing county organization. And so the office person has to have access to a vehicle, but you don't want to have a vehicle just dedicated to that person, office supplies, just all of those indirect expenses theoretically would come back to this program. And so they're included there. If you were to fill it out to an actual TMO at some point in time, it would require at least another half-time equivalent. And so there's the expenses for that second person. The funding sources, there's a program under the federal 5310 Enhanced Mobility for Seniors and Individuals with Disabilities Grant Program that specifically covers non-traditional and calls out mobility management as one of the things they do cover there. It's a competitive grant, but with the BIL money and some of the other money that's been going into transportation recently, it's a less, on my understanding, it's a less competitive grant than it used to be. And my suggestion would be to look at that. There's also the possibility for some employment transportation assistant programs, economic development funding there that would probably not be available in the first cut because you wouldn't be adding anything that specifically helped workforce transportation, but it might be available down the line if you were to look at, say, van pools for employers or something along those lines. Yeah. On the next page, we look at the on-demand shared ride service. There's capital expenses and operating expenses. Capital expenses went up dramatically over the last 2 years. For Chippewa Falls, I work with them, and 2 years ago, they were buying disabled accessible vans, Dodge Caravans for $38,000 under the state contract. The new state contract is for $67,500 based on supply chain and demand and just all of that. So There are grants available for that through the state, and the county would be looking at the state, the rural funding that comes through the state. So operating expenses, I forecast the cost per service hour based on the inflation that we've seen recently, and then also having the contractor supply the vehicle would drive up the per hour rate pretty significantly. And so we'd probably be looking at somewhere in the $80 to $85 range. Hard to tell until you go out and do the procurement and see who's willing to come and bid and work in a rural area. But Running Incorporated runs a lot of the shared ride taxi programs in the state. And so this is based on what I know about their rates and then adjusting for inflation. Now, the funding sources, of course, passenger fares are always a big part of the mix. They usually run 10 to 20% of the cost of it. State and federal grants, and then the local share. And all of the state and federal grants require a local share. Local share is interesting. It can be tax revenue, but it can also be donations from any of the private or healthcare, and sometimes there's foundations that contribute fairly significantly to that. Didn't assume any of that. So if you look at the next page, the graphs on the right, or the charts on the right, based on the assumptions that we talked about earlier, I was estimating the annual vehicle hours would be 7,300 and change. An average fare of $5, the annual number of rides, number of vehicles, and then, so basically, when you take the fare box share off the federal and state, the local share would be of the total of 620,000, give or take. The local share would be about 200,000 for that. Once again, that's pretty there's a lot of variables in there based on the service that's designed, that sort of thing. So since that wasn't the recommendation, I won't go into that too much more, but if you're interested in some of the thoughts, you can read into that. Read that more carefully. So next steps. Partial list of the tasks to be completed to create the position and assess the capacity of existing positions. We've already been through some of that. There are two people with the title of mobility manager that operate at least partially in the county. Both of those are dedicated to the organizations that they work in. SIL of Center for Independent Living in Western Wisconsin has a mobility manager. I actually sit on the board there. And so I talked to the transportation manager and they are already tapped out. So as suspected, ADRC has someone who works part of their time as a mobility manager. I think but it's not specifically for the county-wide services. And so I think that's really important, that you have to have somebody that can weave those pieces together from an overhead view. Structure would need to be decided, and I think there's a proposal for that, and office space and some other things. Interestingly enough, the grant for the mobility manager, the 5310 grant, requires that the mobility manager be in the coordinated transportation services plan that the state requires all counties to submit every 5 years. And the RPC will be helping the county with that plan this summer, and we'll definitely make sure that at least that's in there, because it doesn't, having it in that coordination plan doesn't mean it has to happen, but it allows it to happen. Are there any questions? I'm sorry, I've kind of just been.
That's massive.
No, yeah, it's a lot.
Wow. Anybody have any questions?
Well, it's gonna, at the risk of sounding stupid, the recommendation then is for the mobility manager to basically assess what we currently have and making sure that we're taking of everything that exists now.
Yes, and a big part of that, I think, would be education and marketing is not necessarily a word that people like to hear, but getting the word out that those resources are available. That's always a big problem.
I think you see that in a lot of the responses are people saying that whether it comes from people who directly need or use these services, or whether it comes from the people who work at the facilities that have the people who could use these services, they say like the people I work with don't even know what's out there for
Right,
them.
exactly.
Yeah, so the education piece, I think is huge.
And outreach to large employers, that can be a big part of it too. And then also the ongoing needs assessment, and then somebody dedicated to doing more than what I could do here, which was what can be the next steps. I mean, and these are always decisions that are made by elected officials. And so the environment that you operate in with elected officials has a lot to do with what can be done on the next steps. And sometimes the education, instilling the needs and the data that's out there, and then educating not just the potential people that might use it, but also the public, and then getting that in a information presentable to the elected officials and other folks is a very important part of getting any public transit up and running. So, because it's a big ask. Knowing what the benefits are to the town and what the needs are is important.
So I think you nailed it on the head right there, knowing what the needs are and knowing the benefits that will come from that. Because I want to say, and aside to this too, like for everybody that's in here that's ever going to deal with this public facing or anything like that. When I look at this, when you look at the goals of it, improve access to medical care, shopping and errands, educational opportunities, employment, social and recreational opportunities. You go on down the list, like these are the stated goals of what we would do with something like this. I'm gonna be a little bit heated about this. Not one thing in here says anything about let's turn this place into Metro Minneapolis. But the popular thing right now from former members of the county board is to say, keep Polk County rural. And we don't need this stuff. We don't need these services. And, they want to turn us into the taxis in Minneapolis. And it's like, you could not be more far off with how you're characterizing what this is and the needs that it's addressing and how things would be implemented to address those things. So I would say the education piece as well. There's so many things that we need to jump in front of, because when people see a public transit study, they immediately think that we're trying to implement Uber in Balsam Lake. And so I feel like I'm sympathetic to you on that, because this is such great information and such a great goal to start off with. And so we, I think, have an educational piece as well. So if we see people out there that are saying, keep this area rural, we don't want this stuff. It's like, no, we're not talking about changing us into some metropolis. We're talking about getting, my grandma to her doctor's appointments.
Exactly. And particularly with the aging population in most rural counties, it's just getting more and more present.
Right.
And operating vehicles is not going to get any less expensive over the next while. You look at the price of new vehicles, which is continuing to go up. So the healthcare and the socialization and the shopping, particularly for elder residents, I think is the most compelling aspect of what improving transportation systems in rural counties can do.
Well, to your point, Ryan, all these things can't be true together. We can't say we don't need transportation when we also in our census data have an aging and a poverty challenged county. So those two populations, which are solidly in the 39 to 40%, need some sort of place to work.
And it does feel like I'm just constantly aware again and again how the people who are living in poverty and veterans or elders are not at, some of our elders are at the table, with all due respect, but also I think a lot of the voices of the people that are most affected by this are not present in decision-making bodies by and large.
Absolutely.
So, and that's a frustration to sort of figure out how do those voices and those stories and that reality, what it is really like to have an ER visit and have follow-up and not be able to go there. How do you get the human connection and also the economic impact of that? Because they're gonna go right back to the ER with the next thing that comes down. So it's sort of this idea that if we ignore these kinds of challenges, they'll just go away. And the reality, in my opinion, is we pay dearly for them. Human suffering in the work of our overworked employees here at the county, but also, that just economically we pay for it. It's like upfront or down the pike, what's it gonna be? So.
I won't go over it all, but Appendix B in here does have all of the free responses from the survey. And some of them are, tug on your heartstrings. Some of them are, I just can't imagine don't turn us into Minneapolis, St. Paul. We don't want to see full-size buses running down our dirt roads. And but I think it's kind of what you'd expect in the comments, but I found them informative and useful for my own education that allows me to talk about it a little bit more clearly.
Anybody else have anything?
Madam Chair, can I make a couple?
Yes.
First of all, Ryan, I just want to applaud you. If we could get maybe half the people in the county to hear what you said, maybe the county would have a different attitude. It's, we don't have the press anymore. And like years ago, when somebody would have made a comment, well, we got to keep Polk County real. And, that's what would hit the press and kind of maybe that's how we got where we are. But we are the most negative county in the state of Wisconsin. And we graduate, I can see over the 20 years how we were, and we're starting to break that ice a little bit. But, within the last 8 years, just for an example, we're the only county that didn't participate in the opium, which cost every county nothing. But we had people that would say on our county board and our leadership, well, is our district attorney gonna get involved in this? Well, yeah, he's gonna get involved. He's under salary. He should. But they thought that was a negative. Now I go to these county meetings, like when I was with Wisconsin Rapids last week, and these counties are settled. One county settled now for $8 million. Some of these think that they're gonna settle for actually $40-50 million. Polk County is the only one in the state of Wisconsin. So I just want to get that. It's too bad we don't have the press, because I just want to get that across. Congratulate the people that do have the vision. Instead of having the vision for the maybe 5-10 years future, we got a hard time keeping up with the vision of where we're at right now. And geez, Ryan, I sure want to congratulate you for speaking up for the vision and the reality.
Arnie Lagas, I'd like to make a comment that I just attended a hospital meeting yesterday, and what the hospital thinks it needs, and transportation was high on the list of things that they need to have people come back to the hospital for follow-up visits, like we heard earlier today, and see their physician, and even transport back home after an ER visit. And so it's, I think that so I'm hopeful that we can get a copy of the entire report for each of us. And I find the combination plan of fixed routes and then some direct pickups of people probably the best option for us to consider in the future, but I agree that we should start out with a transportation manager.
Arnie.
My other comment was, yeah, on the mobility transportation manager, I can't think of anything more dire need in the county than that. My friend recently had a stroke and as far as emergency, the hospitals take care of the 911, the lifelink and the emergency vehicles. They did that but from there on. And so I had to get you're on your own. And I had to get transportation from Regents to North Memorial. And then back to our golden age in Amory. And I just, I gotta apologize for the things we take for granted. I called up and I talked to Tanya and I said, well, I know we got vehicles in the county. Endeavors has some handy lift vehicles and I think our county's got a couple. But then, I don't know, we didn't have drivers or whatever. Fortunately, I think it was you, Tanya, that gave me that handy lift number.
Mhm.
So I called these handy lift people out of Barron. And yeah, they said they've got people all over in every, I think in every municipality, there's a lot of people anyway. And finally, but it took 3 days to do it. It took me all day on the phone that day. And then the next day they were booked. And then 4 o'clock the next day, I finally got transportation between the two places. And then a week later from there to Golden Age. And they were very affordable. The bill between Memorial and $120 and $170 from Golden Age. So, you know, it could be even more supportive. But it's, I don't know, for some reason, the communications and everything and county of 45,000 people, mobility manager is extremely important.
Yeah, we're at that point. Thank you. That was great work.
So singing our song over
Yep.
here.
All right, so
We're not-
we're gonna jump in now
Yeah.
with, at the end of the last meeting for the advisory group, Tanya and I were sent with the task of coming up with that perfect plan, which, you know, whatever that means, but,
No light rail. We're not
yes.
asking for light rail.
So, acknowledging, the group acknowledged that really the primary populations that would be using this falls into our area, the aging, disability, the lower income with potentially no vehicle or limited vehicles. So it was put on our plates to look at, and we think we have a good system, two-step process. But one thing I wanted to do is also share something when talking about mobility managers. Over the past 2 months, I have discovered 2 transportation services either in our county or nearby that we had no knowledge of whatsoever. And in order to be able to maintain these services, they have to be used. Otherwise, they're going to say, oh, we don't have enough service here, so we're going to move on or close down. And that's part of the role of the mobility manager too, is to keep the services accessible for everyone here. So, and actually when I found out about one of them, I called them the next day and had them come into the office and talked about just that information, that situation of, we have people who take the ambulance into the hospitals and then we don't have any transportation for them to get back home. So that specific, yeah, so that specific scenario we discussed, and that was just a week or so ago. And so what the mobility manager would do then is become aware of all these services. And if we have like one number for the county to use that would have that, they would know what connections to make. So in looking ahead to what we have going on, and Edwin pointed out that we have the 5-year coordination plan. And this has always fallen under my plate. So as aging and ADRC, we've been responsible for that coordination plan for the county. And I've been involved with it for 5 years or 5 times now. And I know I look very young, but if you put the math together, that's 25 years I've been doing this. Tanya was able to join me in one a few times ago. But anyways, so building off of that, we really want to move on the momentum of the end of this study here, plus having that group coming together for the plan. Because as Edwin says, we need to have it in the plan to be able to move forward to actually make this happen. Also, we need to, in order to secure the funding to be able to try to get the mobility manager next year, we have to have the application into the state by, I believe it's August or September of this year. So we need to have a strong focus and a lot of hard work up front here relatively quickly to secure funding to actually get mobility manager in place sometime next year. So what we're looking at doing is, because the ADRC already has a structure in place, to build off of that. Now, the ADRC programs really currently only cover the elderly and disabled. However, with our kind of plan here, we would use this first year. And of course, this would mean having to pass the board for approval. And it would end up being a 1 FTE increase, but it would be fully funded through ADRC and transportation funds. So if we are able to get that in place, then I would have that person who would be able to fully focus on securing the grant for the funding, and then also with additional transportation funds that we have this year to really work on getting that physical structure and system in place with the computer system. And we do have more room in our area if we need to get a separate transportation office set up. But one of the things that I would like to do in getting guidance or advisory set up in getting our local structure in place would be building off of that 5-year plan. What happens there is we pull all the stakeholders, local vendors of transportation together, county board members, different individuals in the public that would be interested in just learning more about transportation, what their interest would be in using it. And at that coordination meeting, see if we can't secure a handful of people who would be interested and active as an advisory group for getting our local structure in place. So unfortunately, that means a very short time period between now. We have a tentative date set up for that plan of June 8th. So, but this opportunity only comes along once every 5 years. So, and we have noticed that in the aftermath of going through the study, there is a surge of interest in the coordination for the county that does wane after a bit of time, unless you have very specific goals to work towards. So what we're looking at is to have that one position get added, hopefully, sometime between now and summer, so that that person can focus on that transportation piece, develop the actual structure, expanding off of ours, and work on the grant writing and then build, work with that advisory team to look at what it should look like. And then the nice thing about this plan that we have is that unless that funding gets, the grant gets accepted and we get the funding, we do not have to take that next step further. So this position would continue to work towards securing that funding, and not until we get that funding would we hire that mobility manager. And then the funding that Edwin had talked about typically has a 20% match that would be either county levy or local funds that would need to match the federal grant. So,
So the position you're talking about isn't the mobility manager?
correct. But the first, that's step one would not be the mobility manager. It would be a position that I had intended on putting in place at the next budget cycle. So, but with this coming up, what I would do is temporarily use that person as a kind of a project management, utilizing the transportation funds that are available this year, and does not include county dollars. It's our funding, but we have that allocation to be able to manage that for part of the year. So we would do that, get this position in place, and then that position would be responsible for setting up the structure and getting the ongoing funding in place for the mobility manager. Because it really needs someone who is going to be able to focus and, really have this be what their job is. Since I had taken on the transportation back in 2012 here, we haven't had a good position that this is the focus. We've been kind of working around. We have a transportation coordinator, but it's really dispatching our programs, and it's not really meant for looking at a countywide system.
So it goes to then, so fast forwarding to successful, grants and everything like that, then those two would work.
Yes, so the mobility manager and the transportation coordinator would work. It would expand out then from just our population to countywide population. We would have a central call system for people to call into to be able to connect directly with the mobility manager. Hopefully, in building off of the 5-year plan, if we have a good group in that advisory, and hoping that we can get a lot of the vendors, that they would have buy-in to the system as a whole and participate more readily, rather than us getting this in place and then, okay, now how are we going to get the vendors and how do we get them to start cooperating with us? And so I think it really would work, be much more successful if we can get them in as we're building it. So
You mentioned some federal dollar grants. Where does our state of Wisconsin fit on this?
well, actually, the proposed governor's budget does show an increase. He would like to increase a significant amount to go towards mobility management specifically. So we can utilize state dollars to match those federal dollars and be able to pull them in.
You mentioned it wasn't the governor's budget, and I was aware of that.
Yeah.
And the only thing, I talked to our legislatures, and whatever the goddamn governor has in his budget, our legislature are just the opposite. And
Yeah.
so now, when I came back from Wisconsin Rapids, I happened to stop in Thorpe, Wisconsin. Had a history of stopping in there when I was back in Holland. And local people there. That transportation starts at Stanley, Wisconsin. And they have a bus that goes all the way into the Twin Cities. Some of them they service in Anderson, some of them that different places, some of them to the airport. So, you know, they naturally think, well, northern Wisconsin, they don't know there's anybody north of us. And so, yeah. So we need to talk to our legislatures and make our northern legislatures between northern counties and Wisconsin and Polk County that stops on 94. But it's up to all of us, and particularly if you're a county board person, to these legislators. I know our two legislatures here, we're Stafford and Gabe. Our northern legislatures, I don't know them very well, but we need to know them and contact them.
And you're right, there's a lot of pushback. One of the good things with transportation is that does seem to be a bipartisan acknowledgement, so,
Bipartisan is huge,
yeah.
but it can be done. That's how we got $2 million for the Clam Falls dam.
Bill?
It would seem this would be a win-win situation if ADRC is willing to basically do the bulk of the work of getting this set up at no cost to the county. It would seem that would be a marvelous thing to do. You know, looking down the road, if you're looking at a transportation or mobility manager, whatever you look at it, that would fit right in. And then the county would become involved in that. Amy, would it be appropriate for this board to suggest to the county board that we move ahead with this in the form of a motion, or how would you do that?
I was wondering if, do we want a motion on this? Do we need a motion?
I guess, I don't know.
But it's not county, it's not
Vince would be
It's
important here.
not county funded, however, it would be adding an FTE. And that is, I think, and I'm looking at you, Don, I think that's where we need that guidance of approval. I don't know.
We plan on moving ahead with this. We're already moving in that direction now. I'll talk with Corporation Counsel if we need a actual approval. From our budgeting standpoint, as I look at it, it's not going to cost us. Now, we have to add an FTE, but I'm okay with that. And I don't think it's a concern if it doesn't cost us anything. So if I need to get approval, and I don't know, I'm looking over your shoulder at our lawyer.
Oh, wait. I mean, maybe people, but for the grants, would it look better if we had a resolution from this committee that
Yes.
said,
Okay.
we love this project, just for,
The longer trail you can show of a commitment in the local jurisdiction to achieving what they want the grant to achieve with the money, the better off you are. And all of those would be included, letters of support, resolutions.
So you're bettering your odds of grant.
Yes.
that's the only reason I was
Yeah,
thinking,
that's
not a
good.
lot of logistics. Can we wait and do that at our May approval, come back with something? What's our deadline on this grant?
Should be on the agenda, I would think.
No, this federal,
The notice of the availability hasn't even gone out.
so we're good to do it, pick it up.
Yeah, it's, historically, it's been August.
Okay, so we'll do that in May. That'll be one of our, okay.
It sounds like the vehicle to go through is probably the ARD. The ARC.
Yeah, in long-term, one of the things that the advisory group really acknowledged is that to be able to even just get things started, we have to start a lot smaller. And then building off of this, if we can get that mobility manager with the funding, then that person really is the one who's gonna really look at when can we start with maybe another van or something and do more
Yeah.
general public rather than just our limited population? And so that's where this would be that first step. And we can take that first step. And then when it gets to going outside of just our population, that's when we would need to look at that match funding for it. Now, our agency does work with Burnett as well. So we would be looking at a software system that would have both counties included, which is really only a benefit because then we can maybe pull in some services. But then also the benefit would be splitting equally that 20% match for the funds. So,
And I will say regional will, the larger region that you can incorporate into the goals, the better off that is for the application as well.
That also include the tribes?
yes. Our ADRC does include the tribe. Our aging programs are separate because of their federal funding is a little different. But we are partners, but they don't, but on the aging transportation, they don't fall under us. But we do work with them closely, and that would be a target that we would try to get them working closely with us. Yeah.
Ryan, if we're gonna get another FTE person on the county board, you know, the people that we're working with, there's 5 of us here and 10 more out there, we're gonna have a pretty darn good spokesman. We got, you take our trails for recreation now, we got $1.5 million in the budget and 2 full-time people in maintenance and then we can't take care of really everything. Is there any money in your COVID? I think you can do a lot for it.
Yeah, I mean,
With you chiming in.
yeah, exactly, yeah. I need you alongside.
Okay, we're running into some time issues here on our agenda.
Yeah, I hate to leave what's been an awesome meeting, but I've got work meetings that I have to get to that I can't be late for, so sorry.
And we have a couple other work things going on here. Do we think we can wrap up by 11? Okay,
I've got it.
no, you go. You go.
Yeah, no.
I'm going to take off too. Thank you
Okay,
so much.
thank you.
for having
Thank
me.
you for your time.
I have an extra copy if anybody would want one that didn't.
Do you know where you are?
Yeah, thank you.
Um,
I have.
I guess I would like to have an extra copy.
I will get some bound up and set over. I'll also make sure the PDF, there's a copy of it in electronic form so that it can be distributed that way or printed up here.
Dr. Lagos, this is your neighbor Barbara. I'm happy to walk my copy over because I've just read it. And I was on the advisory committee, so I will walk it over this afternoon if you're around, or if you're not, I'll just drop it off.
Thank you so much.
You're welcome.
That's service.
Just real quick, we are starting to grab names for those vendors for that 5-year study. So if you know of any, if in doubt, I'd rather get the same vendors 5 times than not at all. So I'm gonna just pass out my card so you can reach out to me if you know of any out there that we should be inviting. And you know who I am, right?
Okay, number 9, discussion regarding homeless, unhoused individuals.
Homeschooled.
I was going to turn it over to you to talk about our tribal visit.
Oh, our tribal
Yeah,
visit.
Your
Well,
your
yes.
thoughts on that. So we did make it out to the tribal recovery home. What day was that, you guys?
It was a couple Thursdays.
Yeah, it was a
Couple weeks
Thursday.
ago. Thursday.
In March. It was snowy and icy.
Yeah.
So, and Amy
Yeah,
was-
so it was a beautiful house, interestingly decorated at the time for Christmas. And so they're in the process of gutting the place and turning it into, I mean, everybody came. We had the Judge Tolan came. 1 or 2 supervisors came. You came. We had a state person there. Don came. And we had a really great presentation from the guy who's going to be the manager of the site, and they're slated for a June 1 opening. It's going to be ambitious, and we have been invited back. So all the supervisors, I know Denise wanted to go, you will have another chance to go back when they're up and running. Yeah. So it was great.
Right now, I believe that their focus will be on tribal membership. And it sounded like across the nation with Indian Health Services, so that they would be taking people from every tribe in the nation, which would probably not have a lot of capacity for other people to go
Initially.
at this time.
Yeah.
But they do realize that to be sustainable, they will have to go commercial and allow others to be able to be there. So yes, very tall order he has. We'll check back with him and see about that June 1st opening date, but it was very interesting.
Yeah, it's great.
The big point there is that is an example of what can be done and should be done in here. They're doing it.
Okay, number 9. This is for you, Dr. Lagus. Communicable disease report.
So I'm pulling data from March through April, or yes. So far, we've had 115 confirmed COVID cases compared to 139 last year at this time. Right now, our Polk County community levels are low. I think there's only 2 counties in Wisconsin that were in that moderate range, which is great. No influenza associated hospitalizations. Last year at this time we had 1. 6 chlamydia cases. Last year we had 7. No gonorrhea. Last year we had 1, and no mpox at all yet.
How about any Lyme disease yet?
Eye disease?
Lyme.
Oh, sorry. No, not yet.
Although we saw a wood tick yesterday.
Yeah, give it 10 minutes.
Because in the past, I have seen positive Lyme tests in March and April. So it's certainly possible.
Thank
But
you.
we have to keep reminding people to tuck in their pants leg into their socks.
Exactly.
Keep the critters away from us.
Those things. Okay, number 11, Health and Human Services Board. How are we doing? Are we satisfied?
So I have that information over here. So I know we had some technical difficulties and had paper copies and stuff. So I'm just going to kind of go over high level what we had on the results. So the first question we had, or there was different things, but the first topic was about how satisfied are you at the Board of Health and Human Services meetings? And just talked about different things. For most part, everything was satisfied, very satisfied. A couple points of maybe where there could be improvement is focusing on policy rather than management issues and sticking to the agenda. The next question was about how satisfied are you as a board member? For the most part, also satisfied, very satisfied. Some of it where there's areas of improvement would be that working with the health officer or county administrator to ensure enough staff and representing the organization and the public. The next area of questions was how satisfied are you about the board? Again, a lot of satisfied and very satisfied. Nothing that was really on the low end for that area. So for the most part, pretty good. And then the last question was about new board, the adequate orientation. That was also agreed. And I know one of the things we talked about is that we are going to do that orientation yearly, regardless if we have new members or not. And I think we were going to even open it up to the entire board, not just here. So I don't know if Tanya, about that, we're going to do that orientation yearly for everyone.
Yes, we would like to put that invitation out for all county board members for our orientation. So you get that, that snapshot of what we're doing in an hour-and-a-half session.
And these notes of feedback, do we want to, are you kind of having them in, do we need to work on those? Should you and I put our heads together and things on this?
When you get back.
Okay.
And I'll summarize it and send it in an email to Tanya about what I just said here. So.
Okay, sounds good. Nobody said they wanted Snickers bars?
There wasn't that, no, wasn't anything about, I'm sure food always helps though, right?
Okay, any questions on that? You guys good? All right, the update on the division strategic plan.
Yep, and I left my copies down on the printer downstairs, so you're getting the verbal from me. It's not a big deal. We still are focusing on people, purpose, and process, making our efficiencies that way. One of the bigger additions that we have just completed is creating an inclusive culture. So we have our overarching CSD goals, all of the departments, which I believe were equally represented here. They are working within their units and departments on the people, process, and purpose for delivering services to the community through the community services division. So we do it in teams, and it's a little bit harder to print out what we're doing because it's in this planner. It's called Planner, so it's kind of wonky, but we're getting used to that. So I don't know, any other huge highlights that you guys can think of in your strategic plans? Just really focusing on culture, what it means to have a positive culture, inclusive culture. We do a lot of work on that in community services. So
I think the biggest thing is that we're asking all staff to be engaged in the strategic plan, and based on our focus points, they all had to sign up for some area of the strategic plan and participate in that particular topic of choice.
rather than deer in the headlights when you say, we have a strategic plan and people don't know what that means. So, yeah, from the ground up, they're the ones who are creating the goals and working on that. So we share that responsibility with everybody in our staff.
I think it's important too, the newsletter that you put out every month. Again, I think that that's great because it highlights a lot of the different agencies, that are part of this. And then it takes a look at what those goals and program objectives are. And then I think highlighting those individuals that have longevity in your group makes a big difference. And I know that, when you, Diana, when you say that you want to get people engaged, I know that people want to come to work and just sit back and do their job without being engaged in anything that's like a strategic plan. Speaking from experience from doing that at school and putting a strategic plan out to the staff, I'm here to teach, not to do your programming. Well, I can't do your teaching unless you tell me what your program you want to teach. So, and again, I compliment you for doing that.
Thank you. We love and hate that newsletter.
I know that's crazy.
It is. The due date comes way too fast.
Yeah, you just get done with one and now you're starting on the next one. I know how that works.
Yeah, nasty emails go out from time to time. Okay, and then back by popular demand, we're gonna have Lee give the elevator speech of targeted safety and support funding from the state. That's been kind of a godsend for us. We've really maxed out that funding. So she's going to talk a little bit about what that is and the types of services that we're able to buy and the preventative efforts that it is.
Yeah, so the state a few years ago opened up for application and plans for counties to apply for funds for Wisconsin's targeted safety support funds. So what this means, if you could think of how can we safely keep kids in the community, safely keep kids in their home, that's what these funds are intended for. So there's certain criteria that has to be met. The child has to be at risk of being removed, or there has to be a present danger, an impending danger. We have to assess for safety. But if we can figure out a plan to keep the child safe and within the home, then we are able to access these funds. And these funds can be used for anything, for parent education, case management, AODA assessments, mental health. There's some time limited funds that we can use for 4 months that could help out with rent, utilities. So if we think of like if a kid is being removed because the parents are getting evicted or their house is so unclean that it is safety concern for the kids, then we've provided cleaning services and things like that to keep those kids in their home, which reduces that trauma, right? Which then sets them up for hopefully a better future. We have been able to overspend every year our funds provided by the state. And last year I had them pull some numbers for 2022, we claimed $93,000 for TSSF funds, these targeted safety support funds. almost $75,000 of that was case management time. So what we have done internally in DCF is we have bumped up our case management, I guess. So that includes more home visiting. They're checking in with the families more. They're keeping that case open for the full 60 days and doing some more intensive case management. Then we're able to turn around and bill the state for that. So we'll be able to recoup $75,000. The other amount of money, the majority of that goes for AODA testing, AODA assessments. We do a lot of hair follicles. We've helped out with rent, utilities. I believe that this has decreased the amount of kids being removed from the home, which has then decreased our temporary physical custodies, and then also in turn our formal court orders. So these funds have really, I think, helped keep kids in the community and with their families intact. So it's a really flexible way of spending.
Well done. It's good that you guys have the kind of, I don't know if the foresight is the word, but that you have this creative approach to trying to figure out how to utilize these funds that are there. We should do that.
Yeah, and the state provides calls quarterly, so then counties can get together and kind of throw ideas off of each other, and it's been really helpful too.
Yeah, so when she says we overspend intentionally because they re-ob and de-ob money. So that means when we overspent our grant, other counties that did not spend it, we got that money. So we do that very intentionally to be able to capture even more funding.
And it's a 10% match for the county that we have to.
Lee, when you from those funding or funds that you're spending on kids, can you kind of give me a breakdown of majority of kids? Are those kids, are they juveniles from the standpoint of teenagers that are in trouble that would be removed from the home? Or are they younger kids, I want to say elementary age, just generalize elementary age, that would be removed from the home because of something that the parents did?
Correct. It's their child protection cases, child welfare cases only. So there has to be a safety in the home based on parents' protective capacities.
Okay.
So we have to run a report. I just reported back to the state. The largest population is 0 to 6, because those are our vulnerable kiddos.
Right.
0 to 6 age. So those are the majority. That's the age that we're using these funds for. I would love it if they could open it up to youth justice, because I think that we could be
That's
really
why I
creative.
asked.
Right, and that's one thing that I put in the plan when they asked for feedback, is let's open this up to youth justice, because I think we could get pretty creative
Oh, absolutely.
about making connections with those kids in the community and keeping those kids in the community instead of sending them to residential. So fingers crossed.
Okay.
Yeah.
Thank you.
Yeah, I agree. That'd be good.
Thank you. Any questions? Good.
We got a message from Denise. She says that her phone is dying. She might bug out.
Okay. Okay, Denise, we hear you. Thank you. Oh, she's gonna just go off. Is she just gonna go off video? Or Jeff? She might sign off. Her battery's dying. So. Okay, program review. Who's
We
that?
just did that.
Is that what we did? Okay. Do we have anything for legislative update, John?
Madam Chair, I apologize, I didn't get here for the start of the meeting. I had an important phone call. And I wanted to have on the agenda, and I'd like to have a recording in our minutes that you called for a moment of silence in honor to neighbors.
Yeah, we did that right before you got there.
Yeah.
Okay.
Yeah,
well,
yep.
Yeah,
One follow, thank you for
I
that.
thought you would have liked to have been here.
Yeah, I attended last Thursday and Friday. I attended our Health and Human Services Steering Committee meeting at Wisconsin Rapids. Usually we have a list of resolutions to go to our legislature. Our legislature is in session right now. And for a couple of weeks, so we didn't have any, but we will have some coming on the next one. So it was just a matter of organization, really. There were some very good speakers. I guess I got some material that I did leave. I think, Tanya, you got some of the material that I brought from the meeting, so. Don't have anything in specific. I think there's 4 more steering committees. We talked the next one, and this is the first one ever in Milwaukee. And Shabbat asked me, do you really want to go to Milwaukee? Well, I really don't. So I'm gonna be on that one on Zoom, but I'll be bringing you up to date on that. There's three more in April that will be attending.
And we are headed down after this meeting to the Human Service Day at the Capitol. So we'll be advocating all of our human services topics tomorrow. We have an appointment with our 4 representatives at 11:30, so we'll talk fast, leave some paperwork for them and
Who's all going?
that team over there.
Do you have time to say that we talked about mobility and transportation and that we want to support the governor's?
Yeah, I might
budget
get a
on that?
little statement from Laura to add into our supplemental. So what we do is create a little supplemental to put the Polk County specifics
Yeah.
into it for them. Otherwise, they just get this packet that, I mean, they probably get 100 of these, but we want to add our Polk County specific
Yes.
items in
Hot
there.
off the press. It's-
So we don't have anybody from the county board going?
No, we put it out there and nobody was able to go. So they're getting
Well, I remember
blessed
we made a
with.
lot of progress by our supervisors. Actually, they're the ones that we.
Yeah.
Um,
We went down in January and our representatives were very engaged, I would say, asked us a lot of questions. It works well to get them all scheduled in the same meeting and we talk and I mean, the questions they asked were really good. Lisa went with.
And we saw a lot of motion or action and we've had some issues that we brought up with regard to the Department of Safety and Licensing and delays in that regard. And we've had 4 different communications with our representatives of different situations and they were on it like that. And we got communication back from DSPS within 2 weeks. And so it was wonderful that they really jumped on it for us. So I'm grateful for that.
Congratulations that you have a good team. Well, Jay and I talked about going. Wish we could.
I'm sorry, I wish I could too, but not able to this week.
I'll give Jay a call again today and see if something. I'm really loaded right now.
Yeah, and we heard there's record attendance signed up. So they don't even know where they're going to put us all for the briefings and the debriefings after, so it will be standing room only this time.
It'll be in their offices and in the hall.
Yeah, yep.
Okay, well, thank you guys for doing that. That's great.
Thank you.
I also have the annual report that Kathy will pass out for later reading. People who are virtual are gonna get a big fat packet from Shabbat.
And we just printed them yesterday, so.
Or hot off the press.
It does go out on our website also.
Do you think we'll ever
Thank you.
start our legislative meeting at Richmond again? We'll stop this
Yeah,
recording? I
we should
talked
bring
to
that
one-
up.
I talked to one of the legislators this week and
Mhm.
we need that.
Yeah.
What do we need?
They used to have a local legislative event
For
and
years,
that's
we
kind of
had
how.
it at New Richmond.
Richmond.
and
Yeah,
it-
because
it
we're so
was-
far away. It's not easy for people to. just
Well, and
listen.
these are very structured and planned and
Yeah.
the ones that we're talking about, the representatives would show up and we would just have roundtable discussion on.
That's great.
on,
That's to be specific to our county.
Well, I guess, Madam Chair, what I did mention that I should have was this idea of transportation like down to our state hospitals is still. I remember we had the last legislature down there, Sheriff Knudsen from River. Craig County. He just broke down and cried. He said, this is something I gotta present the officer to do, and he said, I don't have enough staff. And now the legislature has funded to build a facility, but they have no funding to run it, so it just seems to be going backwards instead of forward. That was the important thing.
That's good. Yeah. Okay, besides some sort of thing on follow-up resolution for this grant or letter of support for agenda items, I don't have anything else that I could think of. Just our normal.
This is our homework.
That's your homework. I'll take a motion to adjourn.
So I
I'll
saw-
A motion to adjourn.
Thank you, everybody.
Bye.
Denise. Bye.
Thanks for taking care of my friend Rita.
Oh, you're welcome.
Next time, administration,
All right.
my administrator.
That's right. You got another piece of property, huh?
Amy, just to give you an
I was gonna stop out and see
example of
Brandon.
what it does.
Real quick.
Oh, yeah.
Yeah.
She took a half a
Already
day
got one,
and
honey.
went over to
I- yeah.
region